you everybody for being here and for the presentation that we have today. So today we're going to talk about movement through a neurological lens. This is a platform that we've been using a bunch to help all of our clients. So first of all, who am I? My name is Dr. J. I'm the owner of PhysioX. We're a holistic physical therapy clinic out in Needham, and we're just about 3 minutes away from where you guys are, so really close. And before I opened up the clinic, I was a personal trainer, and I worked at Equinox for about half a decade. And before that, I worked in multiple gyms even before. So coming in with 10 years of training experience, and I'm finding a way to combine the training side and the physical therapy side, a way to combine it in a way that makes sense for our clients. And what we deal with mostly is consistent nagging issues that's more chronic. So things that came out of nowhere, things that been going on for 3 months to a couple years, and not really seeing much results for more traditional clinics. These are the people that we like to serve. And so the problem with traditional rehab is this. If you hurt your ankle last week, there's some swelling, you go to a PT practice, they'll find a way to get rid of the swelling, and things can go pretty well. There is a more like a textbook way to take care of these more acute issues. But for things that's been going on for a while, compensations happen. But the issue is that we're trying to take the same protocol we used to treat an ankle that you hurt yesterday and try to apply it for something that's been going on for years. And that no longer happens. So my first client is actually my mother, and she's the person I give credit to me starting this whole thing. When I graduated graduate school, she developed chronic back issues. And I watched her cry herself to sleep every night looking for answers, doctor's appointments after doctor's appointments. She got cortisone shots, and she couldn't walk for more than 5 minutes, couldn't sit for more than 10. And she spent her whole life working manual labor to put me through school. So me coming out of my degree, my fancy degree, I thought I was going to be the one to save her, and I applied everything I learned in school, and that fell completely flat. So I was forced to find other ways to help her. And through that journey, I found the foot and the nervous system. So the foot was was very interesting because I always heard the feet really connects the whole body, and I'm like, whatever. So one day I just started manipulating her feet, and then she stood up and she started walking, and she felt a lot better. Now, she's not cured from that one incident. That's not how the body works. But it was significant enough that it warrants more attention. So I started diving into this world of, okay, what does the foot have to do with anything? And then I looked into the nervous system. Got it. Oh, you got it, perfect. And that's when I was able to finally get her the results that she deserved. And now she's swimming every day, walking every day, and she can finally enjoy her retirement. And this is a picture of us this past Mother's Day. Oh, thank you. So 2020 was really the birth of PhysioX. So what I did was taking all the knowledge that I've gained in my journey to help my mother and just post it online. So I posted a lot about the spine, the sciatic nerve, foot mechanics, and ribcage mechanics. And through that, I've gotten a lot of attention from people from all around the world. And next thing you know, we helped over 100 people from different parts of the world overcome chronic issues, from New South Wales to Amsterdam to India to West Virginia. So a bit of a random groups of people that we would help.
Were these on Zoom sessions because it was 2020?
2020, yep. It was all on Zoom. So we really just watch people move. And based on how they move, we figure out what their body needs, and we give that to them. And what we find is that we give the body what it needs, it finds a way to heal itself. And the brand continues. Oh.
What that means in the way they move?
Movement patterns. Mm-hmm. So I will go a lot deeper into this in a little bit. And if you have more questions, please continue to ask. And so the brand continued to grow and grow. More people got aligned with what we're doing. And eventually we started a brick and mortar practice in 2022. And that's our clinic just about a couple minutes down the road from here. So biggest discovery, the nervous system controls the movement in a subconscious way. So it helps us stay upright and fight gravity and allow us to move from point A to point B. Now you can think about it like a GPS. If you put in a GPS, go into a destination, it's gonna find you the most efficient path to get there, right? Now if there's a highway, you're gonna take that highway every single time. But if the highway's closed, you're gonna circle around, you're gonna find a bunch of different side streets, it will reroute you. You're still gonna get there, but that way that you get there may just be less efficient, less comfortable. But in the grand scheme of things, the nervous system is really interested in survival. For the nervous system, it's really quite all right. Now, these past injuries, roadblocks or detours, I call them compensations. That's kind of what they really are. So what happens in a chronic pain? Well, these side streets, now they become the only way you know how to get from point A to point B. So if your shoulders, really hurt and you need to do this, well now, after a long time of not experiencing full shoulder range of motion, you might only do this every time you raise the arm. That pattern had become connected. So what we find with chronic injuries is that someone have an injury that happened years and years ago, it's healed, but why are they still moving in this way? That's sort of like the highway's fixed, but you had no idea it was fixed, and your GPS continued to bring you onto these side streets the whole time. So let's take a look at a real life example. Let's say 10 years ago you're playing soccer and you hurt your right hip playing soccer. Your nervous system will call a big team meeting, sort of like this. We have a bunch of people in the room, and in the meeting, the nervous system go, hey, look, we need to protect this right hip, but we still need to allow the body to move somehow. So what is the best strategy to offload this right hip? Right, looks familiar. So if you want to protect this right hip, you're probably gonna wanna hike this hip. And if you hike this hip, your whole body's gonna go this way. Well, you're not gonna stand like this. What else are you gonna do? You're gonna side bend your rib cage back over to the right. And then what happened after that? Well, your head's shooting this way, you're gonna rotate your head back this way. And then now, you're gonna limp. And limping is very interesting because we don't need to teach anyone how to limp. It's all ingrained in us. It's in us from the very moment that we're on earth. And through that, we recognize there is a difference in how you place your foot. So if you raise this right hip, chances are you're probably gonna want to put more weight on the outside of that foot. And you will walk around like this. Now, what's the consequence of this? Your right hip can heal, it'll go back to normal, but your nervous system might keep this protective right hip strategy for months or even years. So what do? You're gonna run, you're gonna walk, you're gonna squat, all in the same pattern. That's why we see hip shifts to one side when someone squats, or when they deadlift, they do this, and then they have an ache on one side of the body, or when they run, they have like a left hip pain and a right shoulder pain coming together. So what do we do about this? We update the GPS. We find this highway again. Sounds simple, but how do we do that? That's really the essence of what we try to do. So how? Let's start with recalibrating the midfoot pressure. Most people with stiff midlines usually have trouble stabilizing through the midfoot. So I'm just gonna take off my shoes here, because we're gonna get into the more exercise portion of this presentation, because what I want to do is when we leave here today, I want you guys to have a couple extra tools in your toolbox and kind of use these for clients who may be dealing with some aches and pains, because it may be minor enough that you can't take care of these with some small little warm-ups that we're about to show you. So one concept I want to talk about now is distal stability equals proximal mobility. So I'm sure maybe in textbooks we have heard about proximal stability equals distal mobility, which means if your midline is stable, you can move your arms around real well. But we can also apply the opposite concept. Distal stability with the hands and the feet will allow the mobility of the midline to move free. You can think about when you're ice skating. If you ice skate for the first time, you're not going to feel very good on the ice. You're going to go, your body's not going to be free. But once you feel comfortable at your feet, guess what? Now you can do this. You can do all of these crazy things. That's the whole concept. So the first exercise I love to coach, and this is an exercise I use a lot for a lot of our clients, is a midfoot bridge. So we're going to go and demonstrate to you what that looks like, and then I'm going to have you guys try it out for yourself. Okay? So, you know what? I think better if
I'll demo.
yeah, you be the subject here. And for my Zoom people, I want to make sure that we are getting you guys a view as well. Let's see. Dun, dun, dun. Good, hope so you can see. All right, you can lie on your back. Good. And feel free to come up and gather around. I'm trying to help. I'm trying to make sure the Zoom people have a view, but you guys can Can move around. Can you scoop that up a little bit this way? Perfect, good. So, mid-foot bridge, one of the best exercises. One thing we want to take into consideration is literally right here, the mid-foot. Most people can be pushing down the heel, but when we walk, we take a step, we need to be able to get onto the midfoot and then push off from that region. That distal hamstring needs to work in alignment with our arch and our soleus and everything else. Everything got to work in a sequence. So what I want you to do is just go ahead and press down through here like a gas pedal. I don't want people pushing like a gas pedal. Perfect, good. And once he has this, that distal hamstring is going to turn on. And that distal hamstring attaches right into the pelvis. It's going to give them a little bit of a pelvic tilt. They don't need to force it. It's going to happen automatically when you have this. Good, you feel this? Perfect. And the next step from here, just raise this leg up. And even here, he might already start to feel a good amount of load into that distal hamstring. Now I want you to go ahead and lift the hip up a little bit. Just a tiny bit off the ground. The more they go, actually the less they will feel. So this would be an excellent way to get into distal hamstring through the midfoot. Okay? And come on down. Perfect. I want you guys to go ahead and try this exercise out for yourself. We'll walk around.
Can you give one more, just like step by step, where you loaded?
Perfect, good. So midfoot, press down like a gas pedal. Gas pedal. The force has to come from the foot and it has to translate up.
Okay.
We don't want this going on. We want distal to start the motion. Press through here, and they should already start to feel some distal hamstring to be exact. And then he'll raise his leg up, and then he'll offload. Exactly. That will be advanced.
Is there mild pressure through his left heel?
Left heel, mild.
Because, you know, the default for me is like drive the heels into the floor.
Yes, so that's why we're going over this. When we drive the heel into the floor, even for like a deadlift or such, we're probably going to want to use lumbar spine to come back up. But if we're going down and we're pushing through the midfoot, we're going to drive the hips to come back up. So you guys can go ahead and work through that a little bit. And even the folks in Zoom, you guys can go ahead and work through this a little bit.
Right through down here.
As well.
Good. You should feel, you may feel all the way through here, but you definitely want to feel behind the knee.
Press down.
Okay, relax.
When you press down here.
Oh.
Yeah.
Too
you
much,
feel
too
that?
strong.
Perfect.
Here, I'll get you here. Hold on.
And you can straighten this leg out.
Okay.
Perfect.
Right
Keep
through
pressing,
this, like
keep feeling
honeycomb
this,
area of your socks.
and
You
then
can
you lift
start
your hip up a
pressing
little
down,
bit.
down.
There should
You
be a
should
lot. Oh,
start feeling
down,
this.
down.
Good. Now
Just
lift
that
this
little
leg
bit.
up in
How's
the
that?
air. Don't bridge it. Just lift the leg up.
Perfect.
You should start
How we
feeling a
doing?
little bit more.
Good.
Keep that here. And now
Distal
tiny
hamstring.
bit.
Yeah.
Tiny
So that's
bit
an
lift
area
up
that
from the
most
hip.
people are not getting. It's distal hamstring. We get proximal
more you
hamstrings,
bridge up,
but distal hamstring is super
Chance people are
important.
going to recruit erectors. You're going to get
Distal hamstrings?
glute,
Really?
which is fine.
Came
It
to
just
the right
depends on
class.
what you want to get.
Press down
For
right
this
here.
specific
So
one,
even
you want
before
to
you
go
lift up,
and target here.
you should always.
So the
you
lower
really
your
feel
hips
this.
are,
Perfect. You
actually
can
the
straighten out
better.
this leg now, and bring it up.
Pushing
Still got
down,
it.
Good.
And you lift
and
your
now
hips up a little
lift
bit,
up
just like that.
enough to get like a credit card
Boom.
underneath your
That's
hips,
it.
like there. And you should get more bias
Good.
right here. Feel the difference?
Do you think like a foot positioning is, I see people like they bring it that heel too close to you, but
Yeah, so you want to go, and then too far. Yeah, you want to go somewhere in between, right before like 90-ish. Too far, you're going to get, sometimes people get a lot more pressurized in their knees, so that's why like you get a little more plantar flexion. And then people will say like they feel more in their knee. And
Yeah.
if you go too far here, they're going to feel it more higher up. So, but, yeah.
a little drill, and they say, hey, let's go do a bridge, like a hamstring bridge. So I just play a little bit with
It is
Yeah.
a very common exercise we use because so many times we find people walk, they don't get onto their midfoot. If they don't get onto the midfoot
Yeah.
and utilize this distal hamstring, they will find another way to walk. They would, they might walk
That's
out
where you play around with like foot pressure. 'cause
extend
if you go too much here,
and go.
then
So
you're
they're
gonna
gonna
get more
take
up
those
here.
side streets, but you need to show them the highway. So this is one of the ways
And then if you go
that
too
we get
high
that
up,
highway to
then you're gonna
return.
get more glute and then low back too. So that's why to get more here, just slight lift. Yeah, that's it.
All right.
Yeah.
Very good. So, good. Glad you guys get to experience it. Some very easy to cramp up when you're getting it right. Cramps are good, and I'd say midfoot, very important to cue that in a lot of different activities. It's something that most of us are missing. Okay, the next one is a midfoot slouch. This is one of my favorites. It's the one that I personally use for my own mother to help her get out of back issues. One of the issues with backs, chronic back pain, is that people are using their back as if they're trying to do the job of their hamstrings and their midfoot. So like I said before, they'll take a step and they'll throw their back because they don't have access to these points. And when we walk, it's a knee that bends a little bit and a hip that comes over to meet the foot and then push off. So we're really big on gait mechanics, foot mechanics here, and this matches up to a lot of things that people need to have great mechanics. So this is how I do this exercise. I take a small step. I don't do a big one. A small one, small base of support is more challenging for the person. You're gonna bring your weight right on top of it like this. You're on the midfoot already, pinky toe joint, big toe joint, and I'm gonna slouch. This is the most important part. When you slouch, you shut off the back. If you want a muscle to shut off, you put it into maximum length. So that's how you put the maximum length. You're gonna go here, keep the knee where it is, go down, woo! Go down, and even here, I'm shaking, I'm feeling my glutes. I'm pressing through the midfoot. I come up like a rag doll, Walking Dead style. Nothing is working in the upper back. I'm just coming up, and it's forcing my glutes, my hamstrings, my midfoot to all connect and work together as they're meant to do for gaits, for different locomotions. Okay, so we're gonna go ahead and work on this one. I'm gonna have you guys experience this, and so you guys can coach it also to your clients.
Will you like walk us through it again?
Absolutely.
I'll demo for you.
So,
Can they see
good. Oops, sorry.
There you go.
There you go, we got it. Okay, so first, we bring the hip over on top of the foot with the knee a little bit bent. This back heel can come off a little bit. Perfect. So right now, even before you start anything, you're on the midfoot. You should feel like your calf is working a little bit, your legs are working a bit. And now, the most important part is that we need to shut off your back. So from here, I want you to exhale. So your ribs go down, and then he slouch over, slouch over. Keep your knee where it is. Slouch over, slouch over, slouch over. And when we get to the very bottom, maybe just stay there for like a little bit to keep your head down and just feel your whole entire leg working on that side that you're slouching over. And then go ahead and push through your midfoot. Do not use your back, stay slouchy, and come all the way back up. Perfect. Good. You guys are gonna do 4 reps of these. We're gonna walk around. We're gonna make some corrections if we need to.
Would you like cue gas pedal to like
I'll feel, yep, cue
touch with that?
gas pedal. I'll even cue maybe
Yeah.
squash an orange.
Think about just like
Yeah.
rolling your vertebrae down one by one. That's how you can kind of segment everything till you
There
get
you
to the
go.
bottle. Keep this knee at the
Bend
same
this knee a little bit for you.
In here.
Yep,
keep this
exactly.
knee bent
As you
the
come
whole
up,
time.
you
Go
push,
down, let your head drop.
push, and then you
Good.
start kind of unrolling.
Keep this heel up.
Stay
Good.
floppy all the way up
Oh
top.
yeah. And then when
And
you
want
push,
to
push
delay
through here.
this
Keep your knee where it is.
extending as far as
Push,
much
push,
as you
push.
can until you get all the way up
Push,
top.
push, 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 push.
And then
Lots
your
of
knee
glutes, lots of
extends.
hamstrings,
Because what
right?
happens
Yep.
if this knee snaps back way too early,
I'm gonna have you
whoever
come back
you're
up.
coaching through, or even
I'm gonna
yourself, the
shorten up your
only
stance a
option
lot
your
more,
body
okay?
has
Yeah, right there. Perfect. Good. Bend
is
this
to use
knee.
your back.
Right.
Keep this heel
That's
up.
the only way you're gonna get up. So keep.
And then slouch over. Perfect.
Go back down,
Keep
go
your
back
knee
down,
bend a
go
little
back
bit. Perfect.
Go slow,
push
push,
through
and then
here,
just come up
keep
like
your knee
one
where it
by
is.
one. Stay
Push.
loose, loose.
Nice. You
loose.
feel that
Push
shake.
through the foot,
That's
push
what
through
we're
the
looking
foot.
for. So
you're
delaying
coming
that
up.
knee extension in exchange for hip extension.
Yeah, keep that
I like
here.
the socks, man. Bend this knee a little bit more.
Good.
There we go.
Gonna have this foot here,
And then you push.
just right
Right.
there.
Don't
So
let the
keep
knee come
this
back. Push.
Forward, knee forward. So you want to keep
Push,
this like
push,
positive
push.
shin angle the entire time. Now as you're
Nice.
rolling down, think
got
about
the
your
glutes.
vertebrae. Just
Right.
On fire.
rolling down.
On fire. And you guys can
rolling
try the other side.
So, can you,
Roll,
maybe you're going
roll,
into this might
roll.
head, okay?
Keep
Please.
this knee angle
Tell
low.
me, so if I were to do this exercise with
Now
clients,
there.
and we do 4 reps on
Start
each side,
pushing through here.
what would be the next
Keep the
best
knee there.
exercise for us to go into to apply that feel in an actual exercise we would do in a class or an everyday session or something?
Right. So you can apply this into squats. You can apply this into deadlifts. You can apply this into split squats.
Okay.
So the way you would do it
There you
is
go.
hey, when you're squatting, when they're pushing up, don't cue heel, because heel, they'll fall backwards. Go down, cue midfoot,
Okay.
and it will drive the hip forward, so you get a lot more hip extension.
I'll see you use your whole foot.
For split squats, same thing. As you go down, cue midfoot, come back up. Yeah. Deadlift, hinge. You can be on the heel when you come down, but when you come up, make sure that we get that big toe joint as we push forward. Now, there's going to be a lot more nuances. Like there's foot mechanics with the knee hailing in towards the big toe and all of the other things that we could talk about. But just having the cue of, hey, look, let's pay attention to the midfoot, that would change a lot of things for your clients. Especially for those who feel their back, this is a great decompression, because if your distal segments are strong and stable, the back can relax and they bend over and they're like, woo, I feel all that letting go.
I do a lot of like Jefferson curls for like piece by piece like decompression, but like this is different.
Yeah.
It's almost like unilateral.
Mm-hmm.
Yeah,
That's
I love.
cool.
It's such a great mind-muscle connector before movement.
Yeah.
Wow.
Exactly.
And the
Yeah.
best thing about it is that when you get the movement right, you almost don't have to cue it.
Correct.
These muscles have no choice but to work if you put the joints in the right
It's
positions.
their job. Like, yeah.
Exactly.
For flat foot people, like same rules. You don't change
Same
anything.
rules, yeah. I mean, you can even add like fold up a sock or a towel. Just put it under the arch just so they could feel it even more. Even someone with a high arch, you can actually do the same thing. Is if no one can sense their midfoot, put something underneath there so you can tell them, okay, squish this sock, squish this, so then they get a little bit more feedback of what the midfoot actually should feel like.
Like a minivan, it's for
Yeah. All right. I'm passing the torch over.
All right, sweet.
Dr. Adrian's going to be taking over the upper body. You can
Inside.
inside, just so we know
Yeah.
which one's which.
Okay.
There you go.
Cool. So I'm going to be doing the upper body portion of this. So my name is Dr. Adrian. I'm a former athletic trainer with the Baltimore Orioles before going back to PT school, getting my PT degree, and I'm the head physiotherapist here at PhysioX, overseeing most of the clients there. So one of the biggest things I noticed after a handful of years practicing in athletic training in the professional sports world, I actually started to see that there was a very cookie cutter approach to rehab. And before that, I didn't know any better. I was just told, I was just, starstruck being there, and I was just following everything that they would tell me to do. But after a while, I started seeing the same injuries keep happening. Someone with shoulder pain came in, someone with elbow pain came in, and we just gave them the same amount of exercises, scapular stabilizers, rotator cuff exercises, standing I's, Y's, T's, some sort of variations like that. But these injuries still kept happening. And so I started to wonder, there's something about this whole body integration that's missing, and nothing seems to be personalized to anyone. We're just doing the same exact things. So this is when I decided later on to find out more information, went to PT school, and then finally got into PhysioX, where I learned a lot more different things like the nervous system and biomechanics. So the same concept that we talked about for the lower body can be applied to the upper body. It's just the only difference is you're using your hand. So as before we mentioned, just stiff core equals better movement of the extremities, but that's not so great for a majority of people, specifically athletes, Gen Pop people, and then this changes the game specifically with people who are dealing with chronic or persistent pain. So one of the things I like to look at, and this goes the same concept for lower body as well, but just for the upper body, is limb coordination. So when we test, I'm not really testing some strength or a true measure of strength. I'm seeing how well someone can actually load share through the whole entire limb, because every joint and muscle has to play an equal role all the way up for it to do whatever movement you're trying to do, whether that's reaching, grabbing something, right? Bending down, everything has to work in a correct ratio and in coordination of strength. So just for example, if we're looking at the upper body, we want 20% to start from the wrist and hand, 20% from the forearm, 20% from the biceps and tricep, 20% from the rotator shoulder, 20% of work all coming from the neck, right? And that equals 100%. These numbers are just just for example purposes. And like I said, it's not a true measure of strength because you can actually have someone that's super strong, but they don't share well the load throughout. Or you can have vice versa. Someone's not so strong, but they actually can load very well segmentally going up the chain. So there's a little bit of nuance to this limb coordination thing. And what I like to kind of make an analogy of is kind of like a relay race, a baton race. So you have one runner out of the gate coming out. He has to pass the baton off smoothly and efficiently so the next guy can take it, run, and try to finish the race as fast as they can. So this happens for the upper extremity, starting from the hand, forearm, upper arm, shoulder, neck, and for the lower extremity, the foot, the lower leg, thigh, pelvis, low back, right? But what happens when, let's say, for example, you hurt your forearm, you broke your forearm 10 years ago, and although, like Jay said, that time goes by, it's healed, but now all of a sudden, every time someone's working out and they're pressing, pushing, pulling, all of a sudden now they can't move their forearm or their forearm can't load as well as it used to, and now other parts of the body have to start taking over. Maybe you start getting a little bit more shoulder pain, some sort of impingement starts happening, and we start automatically thinking, oh, well, that must be the reason. But if you dig a little bit deeper, maybe you find out reasons why that might be happening in the first place. So a little quick case study on my end. This is one of my clients. She had a year of right shoulder pain, 6 months to a year, kind of popped up out of nowhere. And the only significant past medical history was that she broke her arm as a child. And she can't really remember if it was her arm or her collarbone or somewhere up in her shoulder. But she had an MRI 3 months ago, and it revealed a partial rotator cuff tear and bursitis. Now, that's a very just snapshot in time. So she didn't even know if she had that right then or she's been dealing with it for a while now, right? So again, the time period has already passed where it's essentially healed, but there's something still off about what she does when she does things like teaches Pilates, so it's affecting her ability to go overhead and teach Pilates classes, and then play tennis recreationally, which she likes to do. So, play a quick little video. I think we might just have to click this.
Oh yeah.
So I want you guys to take a quick look and just tell me what you see as she's bringing her arm overhead and as she's coming back down. I'll play it again. You can just shout it out, whatever you guys see.
Well, her right wrist is doing something funky.
Good. Anyone else?
Looked like just a little bit of compensation on the way down on the scapula.
Her head. She's
Yeah.
tilting her head.
Yeah.
The right wing.
Yeah, the right winging, yeah. So these are things that like I'd pick up.
Popping out.
Yeah. So that one's the biggest one I saw as well. Did see the wrist as well. It's like trying really hard to just go overhead. So seeing all those things, how would you, oh, I guess it did play. Shout out some ideas how maybe you would start to address it, or what would you address first and how would you address it? Just shout out some
Probably
ideas.
like scapula stuff, personally.
Yeah,
So like,
cool.
I would try to use some type of rib cage positioning, expansion on the upper back,
Mm-hmm.
and maybe having some breathing. And I would put the person in different positionings.
Mm-hmm.
Maybe hand and forearms on the ground, like in a pike position,
Mm.
and something like here.
Yeah. Okay.
expanding
So for rib cage,
the rib
got it.
cage. Almost the same concept, reaching,
Yeah.
and that way probably tag to, and combining that with just breathing.
Yeah. Cool.
I like
Yeah.
you.
Yeah,
That's
some
really
good
good.
Yeah.
That's on par with a lot of things that we do as well.
Yeah.
Yeah.
Any other ideas?
I'd probably do some sort of like scapula push up, my quadruped, maybe like scapula cars,
I would send them to you.
either direction.
Yeah. That's another good one. That's
Yeah.
a
Best answer.
With my limb, I don't feel like I would, if we were doing something in class, I would say, don't do overhead movement.
mm-hmm.
That's usually my go-to, is like, let's just avoid
Yeah,
the
yeah.
potential risk at this point. But actually, the first thing I'd probably do is have her roll her lats. I'd probably have her do some myofascial release, just
Yeah.
because I've seen some increase, at least in mobility, like
Right.
at least acutely after that.
Cool. Great ideas. Those would definitely all work, you know?
And a lot of times I see that it correlates with just spinal deviations, like pelvic tilts,
Mm-hmm.
or even tight hips.
Mhm.
Sometimes the source is further
Yeah.
down, and then especially with pelvic tilts, because I have had a winged scapula and I have lordosis, so I've connected it to my performance and my Q out being so tight. So I have to kind of like start down to make it up to finally get it to release down here. Up here,
Right,
so.
right. Yeah, I love hearing the ideas because it is all, you can take all those experiences and try to see if it matches with what you're seeing right in front of you. Because it really is individualized to the point where you have to zoom out a little bit and try these things and then find out if it's working or not. Because that's what that cookie cutter approach for me back in the day was like, okay, we just did it, but then I'm like, okay, we're just getting the same results every single time. So being able to zoom out and try different things and not being afraid to try different things as long as that person's gonna be safe and not in any more type of pain. And if it works, then you find something and you just hang your hat on that. And if you see it again, you can try the same thing, but if not, just try it. There's so many things that you can try, but those are all great ideas. Now, when I did the coordination testing, one of the biggest things I found out was that her bicep and her forearm were not tolerating load well, so I would just label it as weak. But I would actually just I don't even want to use the term weak, but I would just say more like inhibited. They really weren't kicking on as well as they should. So if you think about that relay race, right? Started off here, baton gets fumbled, goes to the bicep, has to work a little harder. This gets fumbled. Now her shoulder has to work a lot harder. So maybe as she's been going on and doing things like playing tennis, instructing Pilates, she's just overworking all the way up here, using her neck maybe because the forearm, the bicep aren't kicking on as well as they should, right? So could the shoulder pain be from the inability from the rest of her limb to actually distribute these forces equally? So that's the kind of question I ask when I see these sort of things with any of my upper body clients specifically. So the left is the before and the right's after. So
We'll do the
I would
after.
play. Yep. And then tell me what you guys see as a difference here.
Shoulders are level on the right.
We'll play.
Yeah.
Like more smooth.
Yeah, smoother,
Yeah.
even.
Yeah, I shouldn't have to like think about it as much.
Mm-hmm.
Yeah, that's a good one.
Yeah. You see, the biggest thing I also see too is the wrist. The wrist
See, that-
doesn't try so hard.
Works.
And then the shoulder blade mechanics cleaned up, right?
And that was how long? Ish.
20 minutes?
Oh.
Within 20 minutes?
A couple months? Just kidding.
This was the same session.
Okay.
Same time frame. Yeah, same
Yeah.
session.
So one thing to point out, when we're talking about side streets, she was using all sorts of side streets. So the scapula coming out is a side street, the wrist bending is a side street. We didn't have to address any of that. Instead, we addressed what the body actually is missing, and all these functions start to come back on its own because the highway has finally opened up. And your body's always going to want to take the highway as long as it knows it exists. And that's really our job, is to show them that this highway is here, body, take it.
Right. So she had tried traditional physical therapy, has tried her rotator cuff exercises, tried some other sort of scap work. Nothing worked for her. And like I said, so I found out that the bicep wasn't tolerating load enough, the forearm wasn't tolerating load enough. So that's what I attacked first. And next thing you know, the highway opened up and she's able to move her arm overhead and the mechanics cleaned up. So, it'll play again.
Want me to
I
just-
got it.
How did you attack it? Is that what you're going to
I'm gonna go into right
You
now.
got it.
Exactly.
You got it. We're not going to leave you hanging.
So everyone here is gonna grab some wall space, but I'll.
Can you go over, before you went over like the restorative stuff, like what did you do to tell the difference? What tests did you do to see that bicep form wasn't functioning at the capacity it should be?
Yeah. So I don't know.
Wanna give it to me?
Yeah. So you could. I'll have Jay here lay down. So what we like to do for bicep is I could do it two different ways. So if we take that same concept of distal stability for proximal mobility,
Hold on, I got to do for my Zoom people. Don't forget about you guys. All right.
If you want to be on this camera, move a little bit further back.
Okay.
There you go.
there we go. So I'll actually probably do this hand. And I'll
Yeah.
just go from here. So the way I like to test it is, again, if we take the concept where everything starts from the hand all the way up, we test from the fingertips. So an anterior load tolerance, I would just start testing Jay here, and you start building pressure into my hand, and I'm just seeing how well we can get to like a nice strong isometric contraction. So I'm just feeling until where he gets a nice isometric contraction and everything can be stable. The wrist is not bending, the elbow is not bending, or he's not doing something crazy and funky with his shoulder. All right, so that's how we can test all these structures here in the front. And then if we want to isolate the more proximal structures, like long head of the bicep, I just take the elbow out of it and do the same thing. And this is where some people, you could see some fingers bending. So for her specifically, she broke at the wrist, which told me the forearm. And then this movement right here, the second we started doing some load into it, elbow went straight down to the table. So that's telling me all this up here was not tolerating load well enough. And we can do the same thing for tricep. It would just be a different position, or you can actually just have someone turn their hand and you have them push down through their mid hand, and you're just waiting to see. You can have someone do this for like hold 60 seconds and have them build up 10, 20, 30, 40% intensity up until 90 and see if they can maintain the same amount. So it's like a give and go. So that's why it's not a true strength test. It's seeing how well they can load share throughout. And then you could do the same thing for the bicep where you palm up and then you're resisting them coming up. So yeah, so for the anterior load test, we'll go into that first exercise. A little wall space.
Yeah, I'm sorry.
Oh, we can go on this wall
I
actually.
realize.
Cool. So the anterior load on wall is a nice isometric that I like to start out with. So it's to restore the ability of the limb to distribute the load equally. And the biggest thing, just like the midfoot, the mid hand is very important for the upper body. So you want to be able to have and coach people to push through the mid hand and the fingertips and not the heel of the hand, which is what most people want to do. All right, and then we want to keep a slight elbow bend at the same time. So we'll just have everyone probably go up against this wall here. It's the easiest. So yeah, we do one at a time, and what I like to do is just start in like a little split stance position. So if you go left foot in front of right, and your right hand is going to go on the wall, and all you're going to do is lift your heel of your hand off the wall just a credit card length away, keeping that slight bend in the elbow, and you're going to start pushing through that mid hand and fingertips, keeping the same. Arm starts working, your bicep starts working, and the front of your shoulder starts working. And this is where you can start playing around with some positions. So like for you, I'd maybe go like a little bit lower and right here. Good right there. Yeah, I mean, you can start up that high, but I'd want to go a little bit more lower for you, a little lower, 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 lower. Like there, keep a slight bend in the elbow. And then since you're in the split stance position, you can move your body weight forward, just keep the slight bend in the elbow as you're pushing through. You could definitely do both arms at the same time. So this is a nice one that if you guys have ever heard of like overcoming isometrics or concentric isometric. So you're just pushing as hard as you can. You're trying to tell that person to knock that wall over, and then you can progress it next to like a yielding isometric or an eccentric isometric, where now you can actually have, instead of being in the split stance, you're going to be just leaning over and having that person control their body weight onto.
Do you want to feel equal
That hand.
amounts of work from the forearm and the bicep?
Yeah, but you want to feel just in general
Actually,
this
it goes
whole
all the
part.
way.
Yeah. Yep. You definitely don't want to have someone have so much pain that they feel like it's, painful.
I have a
Segment it.
brachioradialis injury,
Ah,
so this arm doesn't really like this.
come down a little bit.
Okay.
Okay, so build some pressure into this.
Feel it?
Yeah, that.
Right,
Yeah.
And take this
I
off a
feel
little
more this
bit.
with
And just
maybe,
press. Slowly build the
on
pressure.
right hand dominant.
Don't go 0 to 100 completely. 20, 30,
Yeah.
30.
I was about to ask you if
Good.
you see some
Yeah.
So now you can really feel
back in
a
your
equal
Yeah,
contribution.
going on my tricep a little bit.
drawers, right?
You can even open up a little bit. So we can play around different angles and we can bias whatever structure that we
Yeah,
want to
yeah.
bias.
But that's
Right.
about the distance you want
Especially
from.
when I saw that lady on the wing.
Yeah, and pressing through.
This actually feels
Knock
more
At one point, you measure shoulder.
Effective than some of the other exercises.
What is it? Extension.
Yeah.
External rotation.
External
Yeah.
rotation, right? Like,
Yeah.
Still.
because those.
Yeah, those are adaptations based on because of their sport. But those definitely play a role into it later. But you know, this is a great starting point if you have someone like that. Yeah. It gets thrown off with like athletes because they can move their bodies through different ranges. So yeah, you're gonna have like if it's a right-handed pitcher, right, they're gonna have more built up on the right side compared to the left.
Yeah, I guess.
All right, let's come back to this. How did everyone was able to feel everything starting from the hand, mid hand, going all the way up? So again, really cool exercise to start out with if you have some clients that have been dealing with some like pesky nagging, like especially upper body. I see this in a lot of chronic shoulder pain cases. Is the bicep is one of the main players, and everyone's tried these rotator cuff exercises, and they're just trying to throw things at the wall and see what sticks. And I've been having a lot of good success with starting out with something like this. So the second exercise we're going to try is the scapular protraction on an elevated surface. So something like on a bench we could do. And this is to really start to get some tricep isometrics, specifically the proximal head here that attaches on the shoulder blade, or the long head of the bicep attaches to the scapula. And it plays a really big part in downward rotation of the scap and also upward rotation because it needs to be able to lengthen out as we reach our arms overhead. So same concept is going to go here. We're going to make a fist. I'll coach Jay through it real quick. Forward this way. Good. So this is what I started to do after to address some of like the winging sort of deficits that I saw. So it just wasn't the first thing I attacked, but eventually we do have to address it in some sort of way because she just doesn't have the amount, she just hasn't built up the capacity to. So this is a nice exercise to start getting some tricep isometric, but also getting that protraction. So you're just gonna go quadruped, so like hands and knees, and the most important thing is you're gonna have to put your fist at the edge of the bench because all you wanna do is push through the hand. And the big key here is keep this elbow at 90 degrees. You reach through to the ground with the pointy part of your elbow to get this scapula to protract, right? And once you get that scapula to protract, you're gonna get a little bit of thoracic flexion. So you can also have someone like look down because those early phases of raising your arm overhead require some sort of thoracic flexion, and as you go overhead, then it goes into some extension. So just holding this right here, building up to maybe you did that test and you said, oh, that person only, at 50% was their max, so be like, hey, get up to 50% and we're just gonna hold. And you can see as it gets challenging, you start seeing these shakes, and that just really tells me it's kind of, and you should all be feeling it right in the armpit or somewhere in the shoulder blade as well. And that tells me that, you're feeling everything where it's supposed to, and that's kind of what your body needs. So let's have everyone run through that real quick.
Why don't we go over that one too?
Oh yeah.
Might as well.
So then the progression of this one is you need to be able to have some forearm or lower arm variability or dissociation. So getting that pronation is another important thing that we do. So a progression to what we just did is now instead of having the fist, now Jay, you're gonna have full hand flat on the bench.
Okay. So this part is important because most people do not have pronation, dissociation from the body. So what they end up doing is instead of doing this, they would go like this. So people who have trouble pouring tea, lots of issues with wrists, maybe we need to look a little bit deeper and see if they can dissociate the elbow from the rest of the body. If you put your arm protracted like this and you move, you will notice you need more range of motion from your shoulder blade in order to move your forearm around if you're protracted. So this is a great way to regain that, what we call dissociation from the body.
So the setup is exactly the same. So instead of having the fist, now we're just gonna go hand flat. And this is where it can get tricky for some people because I like to have people, again, push through the mid hand, but specifically be heavier on the index knuckle and the thumb, because that's what's actually gonna get you more of that pronation kind of moment. And you wanna have this elbow still bent to 90 degrees, have a reach, and we'll get a lot more tricep through this as we're holding. So,
And forearms.
and forearm. Yep. So let's go ahead and give it a try. We've got some benches there. You could do it on the plyo box too.
I'm doing the first one. This was the progression.
Yeah, but tell me about.
Yeah.
So I'm thinking about
Good.
riding.
Yeah. And then you can use your other hand as a balance. Yeah, yeah. So then you're only working on this. So you reach through your elbow, reach down towards the
Good.
ground with your elbow.
Good,
Yeah, yeah,
perfect.
so you can get this.
Put your knees back a
protraction.
little bit.
Okay.
So then my
Yeah.
wrist should still stay here,
Good.
right?
So you stabilize
Yeah.
right here. You could take this
Yeah.
hand.
So what I see, so what I
now.
see. Come on up.
So right it is.
Come on here.
Lats.
There you go. Just more with the shoulder blade. There you go.
Perfect.
This might just be a little bit too high.
Yes, it's gonna
But
give you a
you
nice
should
big
feel
stretch
tricep.
around here, and you
You
can
may
also
feel some
breathe into it,
serratus.
expand into your upper
Right.
rib cage as well.
And then you can
so you
get
can
a
add a
little
lot
more
of the
thoracic
expansion and
flexion.
compression principles into this
Right, so then
exercise.
you can even breathe into here to start opening this up a little bit more. Yep. Yeah.
What's the breathing? Because I realized I don't think I took a breath on any of these.
Oh,
I'm like,
I would say take a breath into your upper rib cage if you can. There's just an added bonus to help people free up this area, which is really good for those with neck tension to really have some
Nice.
space around the upper rib cage.
Reach down. There you go. Nice. And then get a little bit of
I like
rounding through your
nasal.
upper back. There you go. That's gonna make you feel a
Inhale
little bit
through the
more of
nose,
shoulder blade
exhale through the
area.
mouth.
Yep.
Coach D, I'm gonna have you come up a little bit. So you see how you're
Try the
just
other one.
like
yes.
this, so you just know
Yeah.
there's
Same
no
thing a little bit here.
weight on your body. So go ahead and
this
do this,
here.
Same
and
thing
then
on the back.
Yeah.
and then go. So now you're
There you
falling
go.
into
now
it.
coach me from here.
Yeah. Now go
Push
ahead
through
and
right
rib cage up.
here,
Rotate. There we
fingertips.
go. Good.
Now you
Bend
should
this
feel a
elbow
little more forearm,
Yep.
a little bit
Come
more
up, come up, come
tricep,
up.
Yep.
fully.
Bring your knees
lot more
away from you a little
through
bit
here.
more.
Yep.
And
Bring your
then,
hips forward a
yeah,
little. So you're
I'll
falling
make it a
into
little bit harder.
Oh, okay.
Right.
Okay.
That's to get
Right,
that
you're pressing down.
dissociation.
Yes.
You're
This
here.
and this.
You're falling.
Because what
If
I see a lot of
remove
people
this,
do
you're falling on your
sometimes
face.
falling
with these
completely.
overhead
Perfect.
issues
So now
is,
you can really tolerate.
you know, you're checking pronation, supination of the
and then
hand,
into that
and
tricep.
one will
Yeah.
go like this.
Thinking about extending her
see.
arm or
You
like
know,
a straight
one
arm
will go
pull
like
down
this.
for like
Yeah, yeah.
I would just tolerate. I would just
Now-
say don't.
Are they still getting pronation?
Don't-
maintain that
Yeah.
position.
Don't fall
Don't
over.
they
fall.
robbing it from
Yeah,
somewhere
the
else?
falling, that was
They're robbing it
So
from the
nothing
shoulder,
with.
right?
Gotcha.
So
One of the best things
this
to trick the nervous
can
system
be
to doing something is to
also
make
done
it
like this.
feel like it's about
So
to
if
fall.
you have someone
Okay.
that's
And
really
it's gonna
struggling,
kick in wherever you need to kick
you
in
can
to
just
stop
play
you from
now.
doing that. I'm
Like
gonna
let's
go
say they
get.
can't get
There
this
we go.
internal rotation of the scapula because they're doing this.
Yeah.
I just buy
Bring this
something
up in
like
a little
that.
bit. See how that protracts your shoulder a bit
Do
more.
the same thing. Yeah.
Perfect.
So
See how
then
you're
you can play
shaking
with those
now.
ranges.
Side that's injured, so right away when I did it, I had like pain right here in the front of my shoulder.
Yeah, now
There we
shift
go.
yourself up a little
So
bit more.
now,
you're like over right
What
over
we'll
the
do,
top.
we'll slowly bring you into
And
it.
now
So
you're
you're
bringing
here.
this. So it's
There
kind
we
of
go.
making it a
Slowly
little bit
press down.
easier, so you're not
Slowly
only
build
pushing
weight.
through
Bring it
here,
weight
but now
forward
you
a
have
little
this whole area.
So
that
bring
you're
your
pushing through.
shoulder forward a little
And it may
bit.
make this
So
a little
just
bit more
less shoulder
tolerable.
flexion here.
Okay,
You should be able to tolerate this a bit
that's
better.
better, yeah.
Good. And this might be where you will start.
Okay. Yeah, because now I feel it firing here, where before it was all referred pain, like anterior
Exactly.
delt.
So she's making that lever longer. It's gonna be
Ooh,
harder.
that's-
Put more.
She's finding those side streets right here.
Yeah.
So we're trying to give her that highway back.
So the biggest change you made to the side was more elbow flexion?
Yeah, long.
Yep, a little more elbow flexion, a little less shoulder flexion, I would
Okay.
say. Cool. Now, let's try hand.
Oh, yeah.
So you're gonna get into the same position.
Yeah, you just try this
So
one.
same position with
Did
the
you try
fist.
the hand? Yeah.
Good.
Hard?
Yes.
And then what you do, keep this where it is.
Right away.
Now
Yeah.
you're gonna take your palm,
Yeah.
boom, boom,
Yeah.
down. So now you
around.
press through
Yeah.
here
Yeah, yeah.
and try.
So again, for
See,
you,
see how it's hard
Yeah.
to
Mid-hand,
bring
mid-hand.
this
So I'll
in
even
while doing
bring
this. Now you have a lot more forearm.
back,
It's just
back,
a lot
back,
more
back.
challenging.
So
Now you have
get- heel the hand
dissociate.
off, and you can push through this area right here, and get this bend in the
Yeah.
elbow in, and reach down.
It
you
wants
get-
to fly
yeah,
out, but you're not.
protract, protract.
Your elbow.
Yeah, keep this on here. Now you should feel a lot more through here.
There you go.
Yeah. But you have I can see you have a
Yeah.
hard time just getting
Get
this
that
pronation
forearm.
in
Yeah,
general.
now you have the forearm
'Cause you
involved
want
in
your
everything
your
else.
elbow wants to come out this way, right? So you want to get,
I feel like tight almost.
yeah. So for you, we've definitely just start here and then start
Yeah,
progressing
because for you to
out
get
so
that
you can start
pronation in the
going here.
forearm,
You can add
it
something like a
requires
wedge underneath
good
to get you a little
mobility
bit more
in the rib
comfortable.
cage. So that's how we linking these two very kind of far away places.
Yeah. Try just do this like quick little test here. Keep your elbows pinned at your side and see what your
It went away, but
Yeah,
I just
how's it
do
feel?
a couple things very similar,
I mean, when I go like this, I feel a little tightness
Yeah.
here, like a very,
It
very,
is
very
because the
tight.
hand is so important, and these muscles are so
Yeah.
often
Yeah.
neglected,
So-
but so
So it'd be
important.
something
And
to
it's
look
also
into
not
because you're supposed to
it's
pronate
not-
and supinate from your forearm, right? And then all these muscles up top need to be able to lengthen when you go here, and they need to shorten, and then these guys need to lengthen when you go up through here.
And in depth.
So
We're like
something
we're
to look at.
scratching the surface
for
here.
sure, for
Yeah.
sure. Well, that's what
I know. Yes. Well, I don't know this level.
You can come a little bit closer in here. There you go. There you go.
Oh,
Just be
here?
right here.
Yeah, yeah.
Good.
Cool. All right, so we just ran through those two exercises, which I also ran through my client, and we got some really good results with that. So just those moves that we just did, for the anterior load one at the wall that we all did, you can start in a very comfortable range. So some of you started here, some of you started like closer in. Depends if you're gonna do this with someone. Try to find an area where you can feel that nice distribution of load and not one area overworked than another. So sometimes you may have to go a little bit further out. You know, Coach D, you said you had a brachioradialis issue and just going straight here was really tough. So for you, it'd probably start you out a little bit wider and you can still start hitting all these anterior tissues here at the same time. And then you can just start exposing all these other ranges and then start making things a little bit more dynamic. You know, maybe you start doing like some wall push-ups, some wall catches where they have to, their hands are off the wall and then they have to catch themselves to come in. So you start making it more dynamic, making it a little bit more unpredictable, like for the environment, so they can still manage all these loads. For the protraction on the block, again, you can go through different ranges and see where you can start someone, but also to start challenging them in the different ranges of shoulder flexion as you go up. And you're welcome. And to create variability at the elbow and the wrist, you start adding that pronation as well. And one exercise I see a lot popular is these upside down kettlebell holds, right? Sometimes people don't even have the ability to go up right here and people start just loading them right off the bat, and now they're taking a side street to go try and get there. Start them off on this block, get them the ability to tolerate that load, stable, and then you work them up. You can start going on the wall, and now you can add that external stimulus. And these are not things that are gonna take a really long time, because if you get the right muscles working, the body has no other choice but to activate them and make them work. And then next thing you know, you can start this up as a warm-up, and then try back and go back to the position. So you don't take that exercise away. Exactly. So you can just make sure they can tolerate that load and then be able to go through. And then if you're gonna go through and start doing like some pressing, you know, it's gonna be very hard after 90 degrees to keep them straight here because the shoulder blade has to come into play. So you gotta go into a little bit of like that scapular range because it's gonna be really hard for them to go all the way up through here at this straight angle of shoulder flexion. And yeah, so some applications. So for the load tolerance, if you want to do something, so I did some hands-on techniques to get her bicep to kick on a little bit better, her tricep to kick on a little bit better. For you guys, you can just have some people roll the bicep out, roll the tricep out, roll the forearm out, and then try the exercise that you want to do again and see if that actually changes. Because changing the stimulus to these muscles will actually get them to kick on better and then get them to perform better doing any kind of exercise that you're trying to get out of. What we mentioned earlier, you can use these as a warm-up or as a retest to whatever exercise you want to do. And then also, what I've been finding out that really works well for me, especially with people with chronic shoulder pain, rotator cuff injuries from the past, is incorporating a lot of isolated work to the biceps and triceps. Those have actually been a lot better, and I've had more results working at the bicep and tricep rather than hammering out rotator cuff exercises till their face turns blue with like absolutely like no result. So if you think about it, the rotator cuff, 4 small stabilizing muscles, but you have bigger biceps and bigger tricep, 2 muscles here, 3 muscles here to be able to support the entire upper arm. So can we actually, one, get your clients to be doing something that is going to make them feel better, right, for their shoulder, but also maybe gain some strength, get bigger arms at the same time, which is something that they would love to do, right? And then you also short circuit having to screw around with some time, having to do some some rotator cuff exercises, right? So just a little bit way to streamline what you guys can do for these clients that maybe have been bothering them with pesky things like rotator cuff tears or sort of impingement issues, anything with pressing overhead. Look into the bicep and tricep and see where you can go and take them from there.
So I do some like bicep isometric stuff, but I haven't really done a lot of like tricep isometric stuff. What do you use for that? Just like same thing here?
Yeah,
Okay.
yeah.
Any other variations or anything? That's like your main go-to?
Yeah, main, yeah.
This was awesome. I have a 2:30 Zoom.
Yeah.
This was incredible.
Thank you. Yeah.
Did you guys love it? I'm
We-
so
we-
happy you guys
Yeah. We were just wrapping up with a couple of things. So, but we'll send you the information afterwards too. We're just gonna wrap up in the next like 2 minutes. You guys have time?
Yeah.
Sweet.
And are you two gonna be the ones to do the workshop in September?
Oh yeah, that's us. All right. So, go back. So let's talk about how physics teams up with you. So we do a lot of these kind of engagement for different gyms, Equinox being one of our bigger ones, but we're slowly trying to branch into other gyms where they have good trainers. And judging from our conversation, and even in the first conversation and the questions that you guys asked today, no doubt I think, having been a personal trainer myself, I love to learn, and seeing how much I love to help people, I always find a way to find the right knowledge in order to do so. And I feel like I see very similar things in all of you guys here today. So what we do for trainers is that we keep your client training with you in the long haul without a pause. Because how many times we send someone to a PT and then they just get lost and they get told these advice, and it almost doesn't even make any sense given the knowledge base that you guys already have. So what we do is we give you all the modifications for the specific client. So, hey, look, this client have a shoulder issue. Okay, well, when they're benching, I want them to use a dumbbell, and I want them to put force through here when they're pressing. So small little things that you can do that can really have a big impact, and we will prescribe all these instructions, so that way we take the guesswork out of the picture, and we follow up these clients to make sure that they're making progress week after week with their rehab to the point where they don't need us anymore. Okay. Next is our affiliate program. So all you have to do is text your name followed by EMPWR to this number. This is our business line. And what we'll do, we'll schedule you a 60-minute consultation with us. Not a consultation, a session. So we'll go through an entire assessment. You guys want to check out your body, know what your body might need or might benefit from doing. We can give you an entire session. The reason why we do that is that we just want you to experience exactly what we do, so next time someone does get hurt, we'll be top of mind. That really is our business model when it comes to doing these type of workshops. And also special offers for you and your clients to be a part of this affiliate program. We can tell you more about it when you guys come in for that consultation. Yeah, that's about it. Oh yeah, scheduled by July 31st. July tends to be a slower month for us, but things pick up really quickly going to August and September. So if you guys are interested, definitely give us a text and we'll get you in the books before the end of July. Lastly, we have a continuing education course on end of September. Alex Effort, are you guys, anyone familiar? You might be, I figure from the conversation that you had with me. So it's a biomechanics course on how to properly assess and correct movements with intelligent programming. So Alex, I took his course before, one of my mentors, I would say. Super valuable stuff, really taking a lot of biomechanic principles and apply it to how you design workouts for people who's dealing from aches and pains or maybe structural abnormalities. So super cool stuff. He's offering a $75 off until the end of June, and we're lucky enough to get him out of Canada to come over here in person to do this workshop. I have some flyers over here that you guys can take. You guys want to check them out. If you guys are interested in coming by and learn, I would love that. These are always great events for us. Okay. You guys can put some here.
Thank you. Oh,
Yeah.
so.
Hey.
Thank you.
Right. And lastly, keep in touch with us. Follow us on Instagram. We post a bunch of different type of things. And now we'll have all of this as a PDF for Ashley, and you can just disseminate all of this to everyone else. Sounds good?
Awesome.
And lastly, We just have some business card here with the same number in the back if you guys forget.
Ah, bueno.